Now, on the 9th of October, which is actually last month, one gentleman very passionate about medicine, herbals, name it. He came out and put out an article in the Monitor for the 9th of October, him saying Uganda is actually ready to solely open using alternative means rather than vaccination, hospitalization, and drugs. How true and affirmative this is, he is on the desk tonight, and he's going to be actually telling us how ready we are to solely open now more than ever. I'm yours truly, Shadrach Shagaf Kisame. And Dr. Chris Mwanje is here tonight to actually educate us on what are those other alternative means. Whether it's politicking, I do not know, but we are here to be educated. You are on the desk, the continent's leading intellectual platform, actually the highest platform for solution finding. Now sit back, relax. If you are a medical enthusiast or you're just interested in learning about the economy, medicine, the COVID-19, the pandemic, name it. Welcome to the show, Dr. Chris.
Thank you so much, Shadrach.
Good to see you again.
Good to see you again.
How many years has it been?
It's been like 2 years ever since I came on
to
this
the
show.
desk. Yeah.
I think I was among the pioneers of this
show. Actually, he was one of the first people to feature on the desk. So let's just catch up. Before you wrote the article, what were you up to? How did the pandemic take you?
Yeah, 2 years back, I think in March, we were hit. Here in Uganda, we are hit by the pandemic of COVID, and it has led to calamity, loss of lives, loss of property, loss of businesses. So no one is really happy about the pandemic, and us as Uganda, we've been in the lockdown for so long. Our friends in the West, where it actually began in Wuhan, they have already opened up their economies. So I'm worried about our nation. And that's why I came here. And that's why I wrote the article.
Let's pick up from your article, the one that was published in the Monitor on the 9th. Just take us through what inspired you to write such an article, because if someone reading it from the other side, they could think you're actually politicking.
No, I wasn't actually politicking. I was trying to give another dimension of medicine that many people don't know. Medicine has its forms. We have the conventional medicine, which is the hospital-based kind of medicine. But we also have the alternative and complementary medicine. Now, when we were hit by the pandemic, many people resorted to what I called complementary or alternative medicines. People resorted to steaming themselves at home. People resorted to nutrition. I think you remember the famous basic kind of nutrition therapy gave the nation. Other people resorted to Covidex, which is a herbal medicine that has liberated so many from
Before we even dive deep into the discussion, from you are a medic, and from your background, what has Covidex really had impact, or it's just theories and people going around trying to get the government to open up the economy?
No, it has really had an impact. Personally, I also got COVID. That was in last year. That was in last year, but I got healed. And what I got healed with was this alternative medicine. I didn't use conventional medicine. Even though I knew that there are drugs actually that can heal me, I didn't go for that route. I actually used...
Why didn't you go for that?
My alternative, because I'm conversant, much more conversant with my alternative. And even then, there was we didn't have an exact kind of drug that I could say could liberate a person from what? From COVID-19.
Till date, we don't have.
Till date, there is a lot of gamble. There is a lot of gamble in the conventional system. We don't have an exact formula. I think you and I remember what we began with. I think it was hydrochloroquine. And from hydrochloroquine, we went to Dexo. So there's always been this whole gamble. We don't have an exact solution. And yet, when you look at the complementary and the alternative, they seem to have solutions.
Before we now dive deep into the solution, let's just talk about the problem to the viewers. What is this COVID-19 in a layman's, like from your background? What is it? Is it just mere flu? Is it a cold? How does it even come up? How does it take over the body?
Well, COVID-19, it's a respiratory disease. It's caused by a CoV-2, a SARS-CoV-2 virus, which you call COVID-19. So it is a disease that we're not conversant with. and yet in its I would say, for example, I was reading a study where some people were alleging that it's actually much more, it's men are more prone to getting COVID than actually women.
Why?
So they were linking it in that kind of aspect because of
sexual.
No, it had nothing to do with the sexuality, but it had all to do with this whole us taking a lot of smoking and all that. They're trying to link it up with a lot of smoking and trying to build such kind of linkage.
Right.
But like I told you, it's still new to us.
Yeah.
Many of us don't have a lot of findings about it. So it's not something that we are yet so much conversant with, except knowing that it has variants and it's caused by a virus. But other than that, else we can find in literature, it's just we're trying to understand the disease much more.
Right.
Yeah, but in the layman's language, it's like how it's called in Uganda, extreme flu. That's how I can call it, extreme flu. Yeah, severe flu and all that. Yeah, that's how I can summarize it.
So, from a medical background, do you think this is the hardest ailment to ever, or the hardest medical or health complication to have hit the earth?
No, I don't believe this is the hardest medical complication. I mean, we've had Ebola. If you look at...
So are you in any way saying Ebola was more deadlier than COVID-19?
Yeah, actually, when you read, most of the African countries are using lessons learned from Ebola to manage the pandemic. So, personally, I don't believe that it's as extreme as diseases we've had.
Right.
Because when you look at the death rate, the death rates of COVID, and try to compare it with other diseases, you'll find that actually even malaria has a higher death rate than actually COVID. So I don't believe it is as it has been portrayed in the public.
So, in other words, you're telling Ugandans not to get worried, yet they've been locked for 2 years, and this is something you're saying that is not as significant?
Well, I'm not saying... Anyway, people shouldn't get worried because of COVID. No, people shouldn't get worried, because if you get so much worried, then counteracting a disease becomes a bit much harder.
Right.
So, I don't call for people to get worried, but I would suggest that actually we can live with COVID-19 just as we lived with HIV, just as we've lived with any other infectious disease. It's not something that can keep us locked down for more than even 2 years. It's something we can live with, and it's something that it will go by itself, just as any other disease.
As we go for a short break, do you think that the scientists that the president always says the scientists have advised, do you think what they're advising the president is somewhat lacking?
Yeah, I'd say it is okay. Yeah, their advice has been okay. And probably it has kept us to a certain level up to now.
Yeah.
But there is need for us to be inclusive, to include other measures that can provide solutions.
Right.
And that's why I proposed the complementary and alternative kind of medicine, because our World Health Organization estimates that 80% of our African population depends entirely on herbal medicine to manage their health conditions.
Right. Now, on that point, hold it right there. We go for a short break. When we come back, we tackle that. Now, just recently, the president came out and adamantly insisted that unless 4.8 million Ugandans are vaccinated, we shall not open up the economy. And he actually said that maybe in January of 2022 is when we shall have hit that number and the economy could be opened up. But do not go away. We're coming back in a bit. All right, now special thanks go to at Susan Ochola Deroy, proprietor for Casa Deroy. Thank you very much for giving us this space to shoot, sensitize, and also educate the nation. Now remember, we're broadcasting here in Bugolobi at Luthuli Avenue. You are on the continent's leading intellectual platform, actually the highest platform for solution finding. You guessed right, The Desk. Now you can follow this very lovely discussion on our social media platforms, Facebook, Instagram, Twitter, do it for Shadrach Kisame, do it for The Desk, and do it for U24 Television. Now, we are today talking about the alternatives for the vaccine and the drugs for COVID-19. I'm with Chris Mwanje, who is a medical practitioner, very enthusiastic and passionate about herbal medicine and nutrition. So you are bringing us to speed that coping from the international folks, World Health Organization, they were saying that over 80% of the African people are maintaining their health, metabolism, like what you call it, using alternative or herbal medicine.
Herbal nutrition.
So you feel like this is what we should have used, same approach?
Yeah, I thought it was much cheaper and easier for us because it's accessible. But also, in addition, I would think our health system still has its own challenges. Right. We have the 6 pillars of the health system: human resource, financing, governance. All of those, we still have gaps in our health system. Now, you are trying to use an approach which is being used in America, where their health system is almost perfect. In Uganda, we have gaps with our health systems. And we are trying to address COVID using that approach, which is not feasible for us in Uganda. And that's why we've been struggling. And that's why we are still actually in a partial lockdown here in Uganda, because our system cannot cope up with the trends and the variants of COVID. And yet, when you look at if you're a student of sociology, you'd agree with me that the people who came up with the motto "For God and my country," they acknowledged that actually what was here and what was sustaining people here was 1, spirituality, 2, herbals, and we were so good at organics. So looking at that and picking it from there, you'd think that actually if we developed our own herbals, our own spirituality, it could aid us much to catch up with the developed nations. Right,
but you made a statement while in your opening.
In line with COVID-19.
Yeah, right now, you when you were opening up this session, you made a very important remark. And you said that COVID hit everyone by storm. Yes. No one was prepared. People are already dying. You need time to prepare as you build your own organics. You do not have that luxury for time.
Yes.
So how then will you be able to curb the gap that these people have already, the other medicine that you don't want the people to use? Because you need time as Ugandans to grow your organic and then to capacity to build the entire nation, to serve the entire nation. I don't think you have that time.
Yeah, let me tell you, Shadrach.
Yeah.
We actually don't need time to grow organics. COVID originated from here. So we didn't need time to originate COVID. There are other therapies that were used by Ugandans. Yeah. We never needed time to get these things. These things are already there. They're already there. They're already on the market. The steaming herbs were already here. And that's why when we had the surge of COVID, people resorted to those steams because they're already there. I would give you an example. I was talking to someone who actually used this whole Christmas tree. The Christmas trees are already there in our community. All you need is to go and uproot it and cook it and take.
Christmas trees used, taken, and they are free of COVID.
And someone is free of COVID.
Dr. Chris, you're live on national TV. You cannot be giving remedies that you're not sure about. Are you sure?
Yes, I'm very sure about that herbal medicine. And actually, the lady in charge, Dr. Nambatya, she's actually selling one of those herbal medicines made from a Christmas tree. So it's a product already there on market. So what I'm speaking, I'm not alleging. So to some people, they are divided people into the most vulnerable people. So you'd find there are people, for example, people who probably have other diseases like diabetes. You'd find that probably that might not work for them. But even with them, it could work as a complementary solution to the modern medicine or the drugs that they were taking. So to certain people, it could work as a complementary. Well, to others who are physically strong, who had natural strong immunities, it was working perfectly as an alternative. But even without just looking at that, look at COVID. It worked perfectly to so many as an alternative.
Then this is the $1 million question. Why wasn't it approved by government or World Health Organization?
With COVID, it was approved by the government of Uganda, by National Drug Authority, to be used by people. When you look at there's another I think it's called Wood, that was there's one that was approved by WHO to be used in Africa, a certain herbal medicine. I'm trying to forget but it was made from Madagascar. I think you remember that herbal medicine.
But isn't that the
it
one?
Was exported to Tanzania.
Isn't that the one that was fought? They said it wasn't working.
No, it was later approved by WHO to be used because it was effective. What we've been lacking, actually, it's not that most of these things don't work. What we've been actually lacking is the lack of data, where people come and confirm that actually this thing healed me. That's the only gap we've been having.
So why, Dr.
in
Christian,
Africa.
why are people failing to come out and say, hey, I used Covidex and guys used this? Why aren't people coming out with testimonials like those?
Well, right now we are doing, I'm currently also doing a study, research on alternative medicines and COVID-19. But like you said, we needed time to do research. Research takes time. And that's why I'm also taking time to do research on alternative medicine and Covidex. And I think before the end of the year, I'll be publishing that research. And I'll probably be giving you feedback that actually, even the data gap now, we are trying to cover it. Yeah, so I think the only problem we've been having has been data. So, but right now, we're also addressing that issue.
Let's look at some of these other African countries. Do we have countries that have been able to open up by using alternative medicine?
Yes, Tanzania is a perfect case.
No, Tanzania never closed.
It never closed.
Tanzania has never closed.
It never closed essential places like churches. Yes, churches essential. To them, Magufuli considered church as an essential part of the community.
So are you in any way saying that the president locking churches is a bad thing?
It was a bad thing. Like I told you, if you're a student of sociology, I studied sociology, and I know very well the background of Uganda, that the people who said that for God and my country, they were not mad to come up with that conclusion. They acknowledged that actually spirituality plays a big part.
But they didn't,
when
they
we are
never
hit by
COVID.
Disaster.
They had never seen COVID.
When we are hit by
know?
disaster, and COVID is also a disaster. It is a disaster, although it's only in Uganda where the Ministry of Disaster doesn't come out when we have such a disaster as a pandemic, and everything is almost left to the Ministry of Health. But actually, COVID is actually a disaster. And when you look, if you're a good student of the disasters that we've had even in Uganda, most of them, it took certain spiritual leaders to stand up and actually address them. You remember Apostle Barabye Kubo, who made the great fight in the fight against HIV when it had just come here in Uganda.
What did he do?
And a lot of his research has been published.
What did he do?
About his impact, about his ability to use spirituality to heal people who had actually HIV. And people were tested.
No, first slow down, doctor. Now I'm starting to believe that you're more of a spiritual leader than a health practitioner. So you're telling people that there's a person as pastor who healed the people of AIDS?
Yes, actually, the documents are there. The manuscripts are there, where people confirmed that actually, yes, I came with HIV, but when I met him, I got healed.
So from your medical background,
is that there?
No, from that your medical background, is that real?
Well, with the medical practice, it may not approve that. However, if it's well documented, like it was and like it is, with those documentaries and the manuscripts that are available, which were documented, then how do I disprove that? Because someone has generated evidence and the evidence is there. So I have no part in disapproving evidence that has been generated and it is available. Like I told you, the only issue that we've been having has been data gaps. But as long as data gaps are addressed and actually policymakers can relate with this data, that, well, I may not know exactly what this man used, but as far as I know, he probably used certain spiritual principles that have worked. I have no business with debating with that. And if as long as it has met the criteria of being published like they were, then I have no business arguing with that.
Before we go for a short break,
yes,
with the article you wrote and you coming on such intellectual platforms, what are you aiming to get?
No, I'm not aiming to get anything. Like I told you, alternative medicine is acknowledged as part of the whole holistic kind of management of disease. Conventional is one of them. Complementary and alternative is also another part. So if spirituality proves itself as part of as a method that can heal people, it qualifies to be part of the alternative medicine. If nutrition, like I practice nutrition almost 12 hours every day, and I know that there are certain diseases which, when you use nutrition in itself and you use it perfectly well, you don't need to opt for any other drug. For example, if someone is obese, they will probably refer you to a nutritionist. Now, if someone loses weight because he has used nutrients, then and he gets desirable results, that one has used alternative medicine to manage that kind of disease.
Right. Now, on that point, let me go for a short break. When we come back, we start right there. Now, nutrition is actually proving to be one of those remedies you can use to remedy the COVID-19 pandemic, according to our one Dr. Chris Mwanje, passionate about nutrition. Now, do not go away. The desk takes a break, and the desk returns in a bit. Now, if you're just joining us, I'm afraid you've missed two quite insightful and also informative segments of this lovely episode of The Desk, where we're talking more of nutrition, health, the pandemic, and we're also talking the lockdown. Now, you can follow this discussion on our social media platforms, Facebook, Instagram, and Twitter. But remember, we are broadcasting here in Bugolobi at Luthuli Avenue at Casa de Roy. Trust me, when you reach here, it's a place that you will not want to leave. The place is quite conducive, lovely environment, lovely atmosphere. Trust me, reach out for yourself. Now, we are still with Dr. Chris. Now, the desk has 10 minutes to go. In case you are there and you have someone that is interested in nutrition, interested in what we're talking about, hit them up and tell them that the desk is live on Shadrach Kisame's YouTube, also on U24 television. Now, Chris, let's just, the economic implication of this thing you're talking about, this vis-a-vis what we are already using, what is more expensive?
What we are using right now, we are opting for vaccination to fully open up. That's by the Ministry of Health, and I think by the President. But
no, Ministry of Health. President is just communicating.
Okay, whatever is going on. But the thing is, vaccinations, it's a very expensive strategy that we've chosen to take. I think you bear with me witness. I was watching, I think it was on BBC, and they were talking about the G20 countries, which pledged to offer vaccines to developing countries. And I was looking at Canada specifically, that pledged 40 million vaccines to developing countries, and they have only fulfilled 4 million vaccines. So that shows you how the danger we are faced as Uganda, if we are going to continue to rely on someone to buy for us and then we use. I think it's going to be very expensive in the long run. But that said, I'll tell you 59% or 60% of our vaccines that we get, even for immunization, are dependent entirely on Gavi funds. So meaning, as a nation, we don't invest so much in our health and even the health ministry than we invest in other things, so like security. So looking at it, if we are going to take that strategy that is quite so expensive as a nation, I think it's going to lead us in a lot of debt.
But people are dying. People are dying, Chris. What would you want government to do? They had to look money or debt versus life. What do we do?
No, people are not actually dying as you claim in Uganda compared to other nations. When you look at our death rate as per COVID, it's well lower than so many nations.
Chris, you're talking to people that have lost relatives due to COVID. You might be lucky enough and you've not lost any.
Well, I might have not lost any, but I know the statistics that are showing the death in Uganda. We've not even hit an alarming, I think we don't even go beyond 10% of our population that has died of COVID. So if we had hit probably of 10%, then I would probably be so worried and it could cause that whole surge. But
so we are not in a state of emergency. Is that what you're trying to tell Ugandans? We are not in a state of emergency.
no, that's that's, I think, what we are experiencing as Uganda. If I compare ourselves to other countries in East Africa, like Kenya, like Tanzania, I would give you the Kenyan approach. The Kenyan approach, they feared to take everything under lockdown because they had studies that addressed, and they said, their own president said, that you know what, we don't have studies to address whether we actually not so ready to lock down our economy entirely, because we don't know what is going to happen if we lock down the entire economy. So they have always had those partial lockdowns. When you look at Tanzania, which you said actually didn't go into lockdown, they have actually upgraded now from a low-income nation to a middle-income nation, meaning that for them, they used this as an opportunity to actually prosper, because they looked at the impact with which COVID was causing to our African nations and the impact to the European nations, and there was a very, very big difference in the death rates and even in the acquisition of the disease itself. Because when you look at our African nations, we are way much better because of our organics that we eat very well, and we have high immunities. So you'd find that actually the spread was not as much as in Europe, where there is very actually organics actually very expensive, and they are very inaccessible in Europe. So you'd find that for us, actually, our physical environment enables us to fight COVID using immunity, using other means which we can actually use, and also allow other aspects of the economy to take shape and also to get back into normal business.
Okay, Chris.
Yes.
Because all we're saying is abstract. Let's imagine someone out there has their aunt bedridden of COVID-19. Using your alternative, what would you advise them to do right now?
Yes, if I'm to talk to someone who has their aunt, of course, I'm saddened if I hear that someone is sick by nature of my upbringing and also my background. And I feel sorry and I cry with them like I'd cry with anyone who has lost a beloved one. However, even in those circumstances, I've been in the hospital. I work in the hospital, and I know the pain people go through, that actually people face a lot more pain trying to counter all those hospital bills that are imposed on them. I think you saw hospital bills worth 50 million for COVID.
Yeah, I lost an aunt who we were in there's a hospital in Naguru there. Actually, she died of COVID, sadly, and left a bill of 57 million.
Yes, so it's good that actually you can understand where I'm coming from. That actually the disease itself is very, very expensive to manage on a household level, but also on a national level. So managing it that way, what I was talking about, the whole immunity, the prevention strategy that we had begun with as a nation, to try and enforce much more on the prevention measures, because we looked at it as a cheaper aspect. However, my argument was we didn't develop it much further to actually help us to bail us out on these expenses and bills, because when you look at the price of Covidex, it is not the same price that I'll get probably other drugs that were used for COVID. It is way cheaper than other drugs. Covidex began at 6,000, and people could afford getting Covidex at 6,000. So how do you think that's even a much cheaper level of managing it at a household level?
As we wind up, how, if you were government with inventions like Covidex, what would you do in popularizing it?
Yes, if I was the government, I would actually promote much more of what we have as Uganda, than actually trying to get and using an approach that our health system cannot cope up with. What I'm trying to say is we are getting an approach, and we are trying to compare ourselves to a vaccination approach to a country that is already manufacturing Pfizer, to a country that is already manufacturing AstraZeneca on their own. Here in Uganda, we're not manufacturing those vaccines. That means it's very heavily, highly costly to us as a government because they're not manufacturing. For them, they are manufacturing and they have the ability to manufacture and sell.
Yeah,
so it's cheaper to them, but to us, it is not cheap. However, if we get our Covidex and sell it or export it to Zambia, then we actually get much more money from it, from our very own medicine, because they can't produce our very own medicine. So what I'm trying to say is, let's build what we have in our nation, what God has given us, and then let's try to mitigate the costs using our own drugs, because we have them. We have the good soils, we have the medicines, we have the people who can actually practice them. So I don't see anything wrong with us using our own things to bail us out of a COVID situation.
Was COVID-19 blown out of proportion?
Yeah, to a certain measure, a lot of people have been using it for their own benefits. I think you saw so much in the newspaper where people were actually using COVID situation to develop and to, pass their own agendas. I think it has been all over the news, and even at a hospital level, you'd find that you had the story where oxygen cans were actually stolen from hospitals, and people were selling them extremely expensively. So
but who is to blame? It's not government, because these are people who are not patriotic, so you can't blame that to government.
No, you can't blame it on being patriotic. I mean, if I'm in badly need of something and then there is shortage, then someone looks at it as an opportunity to make money. And all those are economic situations that we are going through, the poverty levels among the people. And I will tell you, actually, when you talk to people down there, you'd find that someone gets COVID, but actually someone doesn't have money. People have lost the land because certain hospitals demanded that to treat you, you have to present your land your land agreement or land title to actually get COVID treatment. And I will tell you that so many of these land titles are still in the hospitals. So that's how bad the situation has been.
Right. So we've come to the climax of the show tonight. But what are your last words to the Ugandans watching you?
I think my last words is for Ugandans to try and embrace our natural God-given elements in nutrition, in herbals, in physical exercise, those simple things that you can use you yourself to bail you out, because if you are looking at the government to help you, I think it's not going to work for us. And I would implore so much people to try and eat well, pray. And
when you say eat well, what do you mean? As we wind up, when you say eat well,
eat things that are green, that are going to boost your immunity, even as we go through the pandemic. Yes, make sure you engage prayer, make sure you engage physical activity. All
right, thank you very much for coming to the show, Dr. Chris.
Thank you so much.
All right, now a couple of days ago, the president of the Republic of Kenya actually opened up their economy. They are free. And now most of the Ugandans looked at that and thought that when the president comes to the recently concluded national address on COVID-19 would do the same. Unfortunately or fortunately, he pushed it until January 2022, and that was dependent on if they vaccinate up to 4.8 million Ugandans. Now, you've been a lovely audience. That is left in your hands if you want to open up or not, says the president. Now, from me and the entire 24 management, would like to say thank you very much to Cassidy Roy for giving us this place to shoot tonight, sensitize and educate the nation. Now, again, from me and the entire 24 management, would like to say good night, good luck, adios for God and my country. May the good Lord bless this beautiful Uganda. Now, until next week, same place, same time, and of course, same host. Good night.